Good morning. Welcome to the Jesse James podcast. Today we're going to talk about the CDC shakeup. As we all know, the CDC director, Susan, whatever her name is, Monarez. Sorry, I'm going to botch that up. Here we go. All right, so here we go. The CDC director has been fired by Donald Trump. She's gone. She's no longer here. This is the same person who over the years have pushed for COVID vaccines. All right, so here we go. This is coming from Stephen Miller. Let's see what he has to say.
We are working hard, and more importantly, Secretary Kennedy, one of the world's foremost voices, advocates, and experts on public health, is working hard to restore the credibility and the integrity of CDC as a scientific organization committed to the scientific method and getting to the root causes of the public health epidemic in this country. We are working.
So that was a short clip. We heard that, but we all know that. I mean, we've seen these mandates come down from COVID. We've seen what they did underneath all of that stuff. We've seen that they had mask mandates. They had stay-at-home orders. They had close your business orders. They had travel restrictions throughout the world. You had gathering limits on your social events in your private home. You had social distancing rules, vaccine requirements for federal employees. People ended up losing their jobs and their entire livelihood for this same thing, for just vaccines, because they were against them. They didn't want the COVID vaccine. Where's the freedom of choice in that? We had schools and worship places shut down. You couldn't even go to your church, your mosque, your synagogue, whatever you want to do. You couldn't have a small gathering at your own house based on religion. What happened to religious freedom? America was destroyed under COVID. Destroyed. They took all of our freedoms away. I didn't even like what Donald Trump was doing, but it was these people at the CDC, the WHO, the World Health Organization, all of these government agencies that need to be shut down. It's a waste. Maybe not completely shut down, but gutted. They need to be gutted. All right, let's go. They had testing and quarantine rules, just constant on all of that, right? So we'll continue on to see what they have to say on this. So this is from Mario Newfall. The White House just taps RFK Jr. Deputy Jim O'Neill, acting CDC director. So he's the now acting CDC director. He was already there. RFK. I mean, if RFK backs him up, I back him up too. But this is what happened under the COVID mandate, under Joe Biden. This is under Joe Biden. So we had people like Lieutenant Colonel Miller, Ranger qualified, Sapper qualified, airborne, deployed for his country, maybe multiple times, probably at this time. He didn't comply with the COVID mandate. Gone. 19 plus years of service. Gone. Didn't get no retirement, nothing. And you could see that over and over and over on multiple military members. And then when Donald Trump came into office, what does he do? He sees if they want to come back. And do you think they want to come back after the government just forced them to do all these horrible things to their self? Nah, I wouldn't either. I didn't. I retired after it. Joe Biden made me retire. All right, so these are the people that either resigned. They have resigned. They have quit out of protest. So you have Susan, who was fired by Donald Trump with recommendations from RFK. Dmitry Discosalax, I don't know. He's the director of National Center of Immunization. We'll look at him next. So he was, so we'll go over Susan. So let's discuss her role at the CDC. Or prior to her becoming the CDC director, she worked and probably still does work for DARPA. Let that sink in. DARPA. We could dig into that if you guys want. Comment down below if you guys want me to dig into the DARPA stuff. And she wanted to expand the use of wearables to see who is vaccinated and unvaccinated. She was also working with the Biden administration. Sounds great, right? She was previously deputy director of the Advanced Research Project Agency, ARPAH, an agency within the U.S. Department of Health and Human Services created by the Biden administration to accelerate the high-risk, high-reward biomedical research. What's that sound like? Sounds like some Wuhan stuff to me. All right, I don't know. Keep reading. The ARPA is a model after the U.S. Military Defense Advanced Research Project, DARPA. Weird. Another DARPA, just a smaller one so they can do some more Wuhan research. I don't know. It's speculation. She held roles in the Office of Science and Technology Policy in the U.S. National Security Council, where her work included initiatives to combat antimicrobial resistance, expand the use of wearable technology for health monitoring, and improve pandemic preparedness. I don't know. You guys do a little bit more research on her. That's just a little bit I dug up on her. Let's dig in. Meet Dmitry. Dr. Dmitry. He just resigned from the CDC and trashed RFK Jr. on the way out. You know, the CDC that did so well in COVID, right? So well in COVID. Destroyed destroyed children's lives, destroyed religions, destroyed people's lives, fired federal employees just because of not taking a jab. Like, I could understand firing people if they're not doing their job and they're not even working at all. Gone. Most of HR gone. All right, I could understand that 100%. But firing over them for not getting a vaccine that's experimental and have no testing and ultimately ended up showing that it actually killed more people than actual COVID did. All right, that's just my opinion. Another activist removed from bureaucracy like a tick. Winning. Look at this guy. All of these people that we're talking about all advocated for trans and all advocated for the COVID vaccine. Let that sink in. Here's another picture of him from Cat Turd, the famous Cat Turd. Why doesn't anybody believe us anymore? This person is dressed up like a dog. You see this? Dog mask. Like, this is just some weird stuff. Weird stuff. Here's another one. Perhaps Dr. Dimitri was qualified to be Biden's director of the National Center of Immunization and Respiratory Disease, NCIRD, but the media had nothing to say about the magazine cover where he appeared in a pentagram harness. Pentagram harness, force COVID vaccines, forcing trans in the CDC. All right, like, just these things are just getting disgusting and they're just not adding up. Like, I mean, it is adding. It's adding up to the Democrat Party. Is disgusting. Look at this. This is Dr. Dimitri. Pentagrams all over the place. All right, we'll move on to the next one. The chief medical officer. Didn't really find too much on her, but I'm glad she resigned.
Colleagues were outside. I imagine was an emotional moment, and I just wonder what it felt like to leave the CDC under these conditions today.
I think Dr. Hari and her comment really capped it. It was, very bittersweet. I love public health and I love CDC, and so I was really interested in having a long career there, and that wasn't in the card. But what was in the card is that I got to meet amazing scientists and amazing leaders in public health. And what I thought as I was walking out, what I said when I was walking out was, that's what makes CDC. Those people are what makes CDC. And we've been through a lot. There's been dehumanization of people who work in public health, and seeing the humanity. America needs to see that those are the people who are with love protecting their health and the security of the country.
Dr. Howery, just given what triggered all of this, the ouster of the CDC director after a few weeks of Dr. Monarez being on the job, you're the chief medical officer. Had you ever talked to her about resigning? Was it clear that there was tension between her and Secretary Kennedy?
So I had talked with her just around, some of her recent conversations with the secretary, but she was very committed to the CDC and wanted to stay. I think that's just how we all feel. Initially we want to stay, we believe in the mission, but when you can't make things work, sometimes leaving is the statement made.
And have you spoken to her since she resigned?
I have. I spoke with her yesterday, and she just, gave her support to Dimitri, Dan, and I. She wanted to give all the CDC staff big hugs and wants us all to continue fighting for public health in whatever position we can.
Dr. Jernigan, when you look at this situation, she was the first permanent director that the CDC had in months. Yes, there is an acting director that the White House just named a couple of hours ago, but is it clear who is calling the shots and actually running the CDC?
Yeah, that's a great question. I think,
All right, we'll probably just end that conversation right there with her. She said her things. So you've seen that Dr. Dimitri guy on there and the hourly Dr. Howery. You've seen both of them. Both their stances are vaccines save lives, even the COVID vaccine, everything like that. And both their stance are also that vaccines don't cause autism at all. They end the discussion right there. They don't go deep dive into it like RFK or anybody else that say that the mercury going into our bloodstream and into our bodies is not causing any kind of harm or enough harm to warrant stopping the vaccines. They think that the little bit of harm that it does, if it does cause anything, doesn't outweigh the benefits of what vaccines actually do for people. All right, so this is Deborah Hourly. She was the chief medical officer at the CDC. We just watched her speak on what she said on everything with the Dimitri guy. So we just watched her speak right here with Dr. Dimitri on here about being fired. Her stance on COVID also is 100% vaccines work. There was no deaths from the COVID vaccines. All right, we'll continue to the next one. So this is Daniel. He's the director of National Center for Emerging and Zoonotic Infectious Disease. So this is Anna Matson. This is something I found. I really was interested in her whole thread. She has a very good thread, so check it out on her. All right, so Dr. Daniel was the director of the National Center of Emerging and Zoonotic Infectious Disease. Last year, he swore to Congress that COVID vaccines are safe and effective effective. The COVID-19 pandemic challenged the world and rolled out hundreds of millions of doses of COVID-19 vaccines to the American public, challenged CDC to undertake the most comprehensive and intensive vaccine safety monitoring effort in U.S. history. The rigorous approach that CDC and our partners bring to vaccine safety monitoring reflects the commitment to protecting the health of all Americans. Our effort to provide timely and well-researched vaccine safety information to clinical and policymakers and public through evidence-based recommendations, published studies, and engagement with interagency and external partners highlight our commitment to transparency as a core value. The conclusion from the data collected as a part of historical effort is clear. COVID-19 vaccines are safe. COVID-19 vaccines are safe and effective. All right, we could break this down for you if you want. But if you look back at this where it says our efforts to provide timely and well-researched vaccine safety information, that statement right there is a lie. We know that. How do you go from zero vaccines from a virus that was invented in a lab that you have no idea, that you never messed with before, air quotes, that you never messed with before, and then you roll straight into COVID-19 vaccines are safe and effective all within, what was it, 6 months, 9 months? Start taking the jab, get the jab, get the jab. You need this jab. That's all we heard. It'll help you. And then you need a booster shot, and then 2 booster shots, 3 booster shots, 5 booster shots. I don't even know how many booster shots. I stopped counting. That was insane to me. All right, so all of this craziness is just, we've seen it for years and years and years. All right, I think to me, COVID was a mind awakening, eye opening process that America had to go through. It was probably one of the horrific, dumbest times I have ever lived through. I was deployed. I was in Afghanistan in 2020 throughout COVID. I didn't really know what was going on. I was very far away. I heard things from my wife. I heard her talk about how she was out of toilet paper and she was out of this and she was out of that. And it just continuously went down this rabbit hole of people buying things and overbuying things and then limiting people from buying things. And you had to go to Walmart or the shopping center at like crazy hours because that was the only time you can get anything. Plus the social distancing, mask mandates, making my little 3-year-old, 4-year-old, 5-year-old daughter wear a mask constantly. And she had no idea why. That these masks didn't even work. They weren't even like medical grade masks. They were cloth masks. That's what I came home to. My daughter wearing a cloth mask. And then I roll into my daughter being born that same year in August. I have to go through all these jabs. I wasn't able to be in the doctor's room at first or in the birthing room at first. And then they were like, oh yeah, you can be there. I'm like, yeah, I'm going to be there. What do you mean? How am I not going to be there? I'm going to be with this child from the day she's born till the day I die. And you're telling me that me as the father cannot be there because possibly she could get sick? She's going to go home with me. Her mother just left home with me. I don't know. Maybe I'm thinking too logical and these people weren't. Okay, so all under Donald Trump. Why? I think he didn't really know what he was doing at that time. He didn't really have control of the deep state. He was getting his feet under the ground, and this is why the big difference is going on right now in today's world. In America, actually. In the whole world, because you have things like this. They fire the CDC director. They get in Dr. David Whedon, which he was the nominee months ago, if you guys don't even remember this, but he was the nominee months ago, recommended from RFK. And then they come back and say that he didn't have the votes. Donald Trump and RFK Jr. had to go and tell him that he didn't have enough votes to get this. And then we had to put this bureaucracy woman into it. What was her name? Susan, the director, the former director. We had to put her in. She had to be nominated because she could get the votes, which is bull. So now we got the guy that Maha wanted. I need to get me a Maha hat. I'm going to wear it proud. Buy our merch. We're going to have some Maha hats coming up. But I wanted Dr. David Whedon. He's a Florida congressman. I live in Florida. I love the freedom Florida has given me. Like, I don't want to leave Florida. The minute I stepped foot in Florida, I just felt the freedom. Something changed. And even this year, I feel like something changed this year. And it may be the Trump thing. I'm Sagittarius. I feel like it's my year. Me and my buddy, the co-host, Frankie Four Fingers, had this discussion. He's Sagittarius also. This is our year. So here we go. This is going to be the new director of the CDC. Great guy, right? So this was a statement from Dr. Dave Whedon back in March 13 this year. So this is the official statement from Honorable Dave Whedon, now the CDC director. All right, here we go. So 12 hours before my scheduled confirmation hearing in the Senate, I received a phone call from an assistant at the White House informing me that my nomination to the director of the CDC was being withdrawn because there was not enough votes to get me confirmed. Really? The one person that we, Maha and MAGA really wanted didn't get confirmed. He is, I wouldn't say anti-vax, but he is definitely more in the lines of getting the research to see the vaccines. Let's see what's going on to this. What caused autism? We have in 1940s, 1950s, 1 in 5,000 Americans had autism. Now today, 2025, 1 in 36. 1 in 36 have autism. That's crazy. Crazy. Why? Why is that? Why is it that we should have the best healthcare? We pay the most for healthcare. We do the most research, and somehow we have the worst healthcare in the world. All right, let's see what he has to say. This quick 40-second clip.
What the federal government really needs to do is step up the level of effort and get answers to these questions. Now, I've been prodding our research agencies like NIH to do more and more, and they have been investing more in autism research, but they're not getting the answers. And what people want are answers to these questions. Are these vaccines safe? Is there a link or is there not a link? And we haven't had the good, rigorous kind of independent research that we need. And until we have that, the federal government, I think, is going to just engender erosion of confidence on the part of the American people.
All right, let that sit in. That was from 2008. We're almost 20 years later, and we still have no good definitive research that's not paid for by big pharma on vaccines. Why can't we do this research? What is stopping it? What is bureaucracy is stopping this? Why do we have to have 50-something shots or even up to 70-something shots in our kids before they are 18 years old, and we're forced to do it just so they can go to school? Why? Why does that? Comment down below. Let me know what you guys think. Why? Here's a little bit more information on him. All right, here we go. Let's see what this is. I haven't watched this.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real world data. Our data.
All right, let me know on your thoughts on that, because we 100% know that they would get vaccinated and then literally turn around and be like, you need a booster. You need 2 boosters. You need 3 boosters. Nobody's getting sick off of it at all, but you need these boosters. This is the Jesse James Show. Thank you for watching this and checking me out here on YouTube. Make sure you give me a follow on my social media platforms also, and make sure you like, subscribe, and share this with all your friends. Comment down below. I want to put out more. I'm going to keep putting out more. I'm going to try to get a couple videos a day, if not more. Thank you. I appreciate you guys' time, and make sure you guys give us a like, share, and subscribe.